Is it recording?
Yeah, you got it. Yeah.
Morning.
Good morning.
Rep. Howland will call the roll.
Let's see, we start with, Representative Burnham is excused, so this will give me a good task to start off with. Those of you that are on Zoom, when I, call you for the roll call, just say that, just a vague reason why you're not here and if you're alone in the room. So, the first up to test that theory is Representative DeRoy. You're muted.
You're muted.
I'm sorry. Yes, I'm home because I'm not well today. I think I have pneumonia. I got to go to the hospital after this meeting. And then I'm only here with my 2 dogs.
All right, well, we'll try to be brief. Representative England.
I am also here with 2 dogs and not feeling well. So
Thank you. Representative Howland, I'm here. Representative Kaczynski.
here.
Representative LaMontagne.
Here.
Representative La Rochelle.
Present.
Representative Potenza is absent.
She's
On the way.
she's on her way.
Yeah, she's on the way. Wow.
Oh, she's on her way. Okay, well.
And Representative Wall.
I am here.
And then we also have attending, Representative Bailey and Representative Schmidt. So we have quorum. We are ready to go.
Okay, has everyone reviewed the, meetings from, the minutes from the last meeting?
I move that we approve.
Okay.
I will second that. We have to do a roll call vote because we have, people on Zoom. So, Representative, DeRoy,
Yes.
Representative England,
Yes.
Representative Howland, yes. Representative Kaczynski,
Yes.
Representative LaMontagne,
Yes.
Representative La Rochelle,
Yes.
Representative Wall,
Yes.
and minutes are approved.
So I don't have an agenda for today. And I have, in all honesty, with everything I've been working on, I haven't even looked at any of this since the last meeting. Been kind of overwhelming. My mother passed away. So I think it would be a good idea if we all just have a conversation about where we think we are possibly going to go. And I think one of the comments that has really stuck with me in my mind since the last meeting is that everything that we have had to operate going forward is really in question now. All the Medicare, well, Medicaid funding, you know, and potentially even Medicare funding that we have used to support the nursing home and the service we provide with citizens of Strafford County is really up in the air. And we already know that there are cuts for a program that's not fully supported by the state, that we've already been operating with a lot of taxpayer subsidy of the nursing home. And that's really at the brink of, you know, it's not sustainable, let alone how are we gonna try to improve the conditions of the nursing home or building new one. So it's frankly really depressing.
Oh, let's not think about it that way. This is a new opportunity. It's a new opportunity for us to look at things differently, and perhaps something good will come of this. Let's not get depressed about it. Let's just think about now it's time. And I see this with schools. I see this with a lot of things. And I think that this team that we have of Democrats and Republicans can make it happen. And it might not be a $350 million beautiful nursing home, but what comes of this could be very, very good. I want to stay positive about it.
I would thank you for that, because it is easy. I mean, first of all, I think the work that we've done has pointed to the fact that the status quo doesn't work anymore.
Mhm.
Yeah,
And I think you're correct, because I've also worked municipally and with schools, and we're seeing the funding structures that we relied on no longer support what was a traditional model. And that would be including, I mean, we've laid out at least what the funding is, we've laid out what other counties have done. But I think when you look at the cost, the economic reality of trying to fit a bond into a budget that's already under stress, and I think to broaden that out, when I look at Durham's municipal budget, when I look at the school municipal budget, and when I look at the county municipal budget, all three of them are at least double the rate of inflation currently, as
right.
proposed.
Yeah.
All of them, all of them. It is not one single one. I think there, to my mind, this is because we've gone, and I think the commissioner alluded to this. We had the funding that came in from COVID, the American Rescue Plan, that helped support a lot of structures that were already stressed. And that funding has dried up, and we are not only has the funding dried up, we've faced significant cuts. I think there's also a story that crosses over from the municipality to the schools to the county. And that is, there's been a continued downshifting of responsibility and cost from the state to the municipality that they're bearing. And so that is the reason that all three of them, not one alone, are facing this. So to Representative DeRoy's point, it is an opportunity to think about how we come out on the other side of it.
Mhm.
Well, Representative Roy, do you have a vision? DeRoy, I'm sorry,
That's
of
okay.
a vision of what you think something new would look like?
You know, I think forgive me, I have a dog that's sitting beside me, very sick. Oh my God. Um, you know, we talked about possibly having a whole different type of structure for our indigent and utilizing all of the um, venues that we have around us. And maybe it isn't that we need to have another nursing home. Perhaps we restructure the way these other ones are and we utilize their talents and support them with the people that we have. I think that was one of the first things that we had talked about, and maybe we pursue that a little bit more and see how that would fit our agenda. Does that make sense to you?
Do you mean private nursing home?
Yes. Perhaps maybe doing a voucher program. And because we do have to take care of our indigent, there's no doubt about that. We have people that can't afford to take care of themselves. And maybe there's another opportunity for this building to be used in another way. But we have resources, we have the ability to, that there are many nursing homes out there that do have empty beds. And let's give it a try and see how that might work through discussions.
So I just had a bill go before the Housing Committee on Tuesday that dealt with nonprofit tax exemptions. And what came in there actually was interesting. So it was not all nursing care, assisted living, all of that did come up. Catholic Charities came in there and mentioned, by the way, they're operating at a net negative operating right now, which is
Yeah.
not actually sustainable. So
Right.
the idea that we would offload county responsibility to Catholic Charities or those type of organizations clearly is not economically viable either. The thing that came up that was really interesting was some of the higher end, for people who have money, what happens to them? And that was Riverwoods came up, and I cannot remember the name of the other one. I think it may have been it was either in near Nashua. And so it was kind of interesting because they charge a significant amount of money when you come in. You buy into their apartment. I think the starting is around $800,000. And that money is supposed to then carry you through. It's kind of like supposedly Hotel California. You check in and you never check out.
Right.
You're supposed to move through the system, and your assets and supposedly the collective insurance is supposed to cover the cost of you all the way through. And the kicker about these, which sounds really great, by the way, from the county, because we're saying that they're not picking up taxpayer money. This is not true, actually. They do not actually currently, under current law, they are not paying full property tax. They have a
Mhm.
high, and they're paying about 50% of what their expected property tax would be, even though they are not necessarily providing a benefit. So that there's, right now, it's an interesting time, I guess.
Is that because it's a senior, like 55 plus, the same way like these housing divisions that are 55 plus are exempted from some?
Because they're
Yeah.
using nonprofit status, supposed non, and I believe Representative DeRoy has signed on to the bill that I just talked about. And because they have nonprofit status, when they go to build their structure, they are able to negotiate less than anybody else would. So they are actually receiving a municipal tax break. The taxpayers are footing the bill for this.
Thank you. And thank you for your comments, folks. What we're not looking at apparently is the fact that the people who go into Riverside are the people who have next to nothing or nothing, and they don't
Riverside.
qualify, they will never qualify for a private nursing home. They don't have homes to sell, such as with Riverwoods. You sell your house and you commit, you give everything to them, and if there's anything left over theoretically, when you die, it goes back to whomever is supposed to be inheriting, your family mostly. These people at Riverside don't have that. What are we gonna do with our population? And there's a strong population of people who are really indigent and really need care. We can't just dispose of them. They can't be out on the streets. They have to be somewhere with quality care. And we have, by federal government and state government, rules and regulations whereby we are obligated morally and legally to take care of the people who have so little. We have to have a nursing home like Riverside. Thank you.
I got a question from Representative Kaczynski.
I don't think Representative DeRoy was saying that we throw them on the street,
No, she
No.
wasn't.
you know?
I didn't hear that either.
And,
I didn't hear it.
but what she did say about a voucher program is taking care of them. I understand that there are people in this delegation that are not gonna go for something like this because they don't like to contract out, but what Representative Potenza recently brought out, that we're paying $230,000 plus for somebody. I happen to be dealing with something like this now, and in the private sector, it's substantially less. You're talking 160,000. How could you have that difference? And if there is that difference, how could you, does a political party mean that much? You would say, I'm not gonna just pay the money to the private for the cheaper price, for that substantially cheaper price. She got a list with the losses here. You're talking $9 or $10 million a year. You know, the taxpayers don't really know what's going on with this. And I'll tell you something. This started in 2022. And if the commissioners weren't so greedy with a $170 million plan, you would have had a nursing home. But no. And you know what? It's good. Because now we opened up the can of worms, and we, little by little, we're seeing more and more what goes on, what the costs are. And we're supposed to be representing our constituents here. And I don't know how you could correctly represent them and say, I'm gonna pay $230,000 when I could get that product for $160,000. I'm sorry.
Can I just make a point of order? I don't want to, as is the rule at the House, I don't like to inspire to put intentions on people. I think starting off by calling somebody greedy is just not what, it doesn't help what I think has already been a substantive conversation. To Representative DeRoy's point, what I heard, and to what I've heard every bit around the table say, that the same thing, the current system is not financially sustainable. And so, I mean, what Representative Potenza's report, at least what I've seen preliminarily, speaks to what we just said, and we've all said that.
And I'd like to speak more. I brought it up at our, at the budget meeting in regards with Riverside Rest Home, so, can I read? Okay. And I wasn't gonna hand this all out because a lot of this stuff is going to be on the report, so. First, I'm gonna discuss when I first got the numbers in regards with the Medicaid cost report loss. So I'm gonna talk about that. That's 2024. We don't have 2025 yet. And then I'm gonna get into the losses going back to 2015. So what the 7.165 million Medicaid cost report loss means economically. So basically, this is the closest thing to a real P&L for a nursing home. The Medicaid cost report is not a political document. It's not a budget wish list. It's a standardized, federally required accounting statement that all Medicaid certified nursing facilities must file. Providers are required to report actual revenues and actual expenses, allocate indirect and overhead costs so that only expenses attributed to the licensed nursing facility are included. They use consistent definitions across providers. Because of this structure, the reported loss of 7,165,426 for 2024 is functionally the operating loss of a nursing home as if it were a standalone business. In other words, if RRH, Riverside Rest Home, were not owned by the county, it would have lost over 7 million in 1 year. This loss reflects structural operations, not a one-time anomaly. A Medicaid cost report loss of this size indicates that reimbursement rates are materially below the cost of providing care. Fixed costs, staffing, benefits, utilities, compliance do not scale down fast enough as census declines. The facility is operating below its economic break-even census. This is not a timing issue or an accounting artifact. It reflects a structural mismatch between what Medicaid, the dominant payer, pays and what it actually costs to run the home at current census levels. County ownership masks, but does not eliminate the loss. In a private facility, a $7.2 million operating loss would trigger the following: immediately downsizing or closure, sale of the asset, bankruptcy or restructuring. In a county-owned facility, the same loss is absorbed by taxpayers, spread across the county tax base, embedded inside departmental budgets instead of appearing as a single red number. The proposed 2026 budget shows 39.34 million in RRH expenditures, with the gap between expenditures and revenues made up through taxation. That 2026 proposed budget, basically the Medicaid cost report, tells you how much of a gap is not temporary but structural, and why the loss matters more than the budget alone, because the budgets basically answers the question: how much money were we planning to spend? The Medicaid cost report answers the most important question: does the business model work at all? A $7.165 million loss in a single year means, even at today's staffing levels and census, the operation cannot sustain itself. Any new building, major renovation, or long-term recommitment would lock in decades of future losses. Capital investment would increase, not reduce, taxpayer exposure. This is why the loss figure is so critical to policy decisions about reinvestment versus exit. Real-time operational reality at RRH. Economically, RRH is operating in a mode that is best described as below sustainable census, high fixed cost intensity, Medicaid dominant payer mix, rising labor, benefit, insurance, and compliance costs, declining ability to spread overhead across residents. At census falls, cost per resident rises, which further widens the loss, creating a feedback loop that cannot be corrected through management alone. What this implies for future policy choices. Taken together, the Medicaid losses and the proposed budget imply continuing operations equals continuing structural losses, building or substantially reinvesting in a new facility would mean intentionally expanding a loss-producing enterprise. A drawdown or phase-out strategy is not ideological. It is financially compelled. The Medicaid cost report is effectively telling the county in quotes, at current utilization and reimbursement levels, this facility does not work as any sort of business at all. Bottom line, the $7.165 million Medicaid cost report loss is the strongest available economic evidence that Riverside Rest Home is operating at a structural deficit, not a cyclical one. The proposed budget shows how that deficit is financed through taxpayers. Together, they demonstrate that continued county ownership transfers ongoing operating losses and long-term liability from the healthcare system directly onto the tax base. So now let's get into this other piece. So this is the Riverside Restaurant 2015 to 2024 Medicaid cost reports. So all these figures basically are cited, they're derived from the Medicaid cost reports, which represent, like I said, the most accurate and standardized measure of operating performance for a Medicaid certified facility. These reports require providers to allocate indirect and overhead costs so that only expenses are attributed to the licensed nursing homes services included, producing a result that mirrors the profit and loss P&L statement of like a private business. Okay, so here we are. Riverside Restaurant reports right now, 2015, 3.4 million, 2016, 4.6 million, 2017, 6.37 million, 2018, 6.39 million, 2019, 6.7 million, 2020, 6.76 million, 2021, 4.7 million, 2022, 10 million, 2023, 9.95 million, and then in 2024, 7,165,000. The total cumulative Medicaid operating loss from 2015 to 2024 is 66,190,714. Want me to say that again?
No, you don't have to.
Unbelievable. Average annual loss is approximately, if you average all that out, is 6.6 million per year. These losses exclude any additional capital expenditures or deferred maintenance or future facility replacement costs, and therefore represent operating losses alone.
What,
Want me to keep, I'm gonna keep going, because there's some more things in here. This isn't a budgeting issue at all. It's truly like a business model failure.
It's not.
It's not a
It's not a
business.
business. Let me-
It doesn't matter. It's still operating as a business, okay? Because you have to look at it, there's no other way to look at it except for that.
Yeah.
You have to look at specific numbers. We do budgets based upon economics. In economics, you have to use it, you wanna say business, it doesn't matter. Government shouldn't be acting as a business, but obviously,
Well, I'm
there's
just
no
gonna
other
pause
way
you
that
one
we can look
second.
at this.
Cause you're right in the budget time. If I were to pull up the Oyster River school budget, by the way, this mirrors exactly what you're talking about.
Okay.
Things like public schools and nursing homes operate at a deficit. That is just, and it is a structural issue. It's a structural issue in the state, in the case of the school system, the state has been found unconstitutionally underfunding the schools for decades. And as a result, they have passed the costs on. So they are that is a structural problem with funding. The same structural funding that we're finding in the nursing care with the Medicaid reimbursement, rather than the state picking up what is its percentage, which is 25%, or is it 50? The state pays 50.
Right now, the feds pay 50. The county's
Except it does.
47%, and the state pays 3%.
Okay, so if the state paid its fair share in the same thing as the schools, either of those would provide revenue that would directly impact the taxpayer, right? Because that
Correct.
cost has been downshifted, either of those. And I'm not meaning to go long-windedly, but it is a systemic problem that falls on across public services. And so that is why they operate at a structural deficit. I'm just gonna throw the reason I'm bringing this up is that, yes, we acknowledge, there's no argument with you about the deficit of the county nursing home, as there's no argument when you go and you do your deliberative session for your school. The question really is, can the private sector make up the delta of that $7 million effectively? And so the thing that you need to prove is, can you do this more efficiently than or can you operate, or can the private sector absorb what is a $7 million operating cost and be sustainable, which is what we're waiting to hear.
All right, can I continue?
Yeah.
All right. So, like I said, this is basically a failure. So because these figures come from Medicaid cost reports, they're not discretionary budget estimates or internal accounting choices. They reflect actual operating revenues, actual operating expenses, required allocation of overhead to nursing home services. So in economic terms, these losses mean that Riverside Rest Home's cost of providing care has exceeded its reimbursed revenue every single year for a decade, even after standardized cost allocation. This is the clearest available evidence that the nursing home does not function as a viable operation under its current utilization, staffing, and reimbursement structure. County ownership does not reduce losses, it transfers them. So in a private or nonprofit setting, a facility posting 10 consecutive years of losses, 2 of them approaching 10 million annually, would not continue operating unchanged. It would be forced to downsize, restructure, sell, or close. So under county ownership, those same losses are absorbed by the county, backfilled through annual appropriations, and ultimately paid by property taxpayers. The Medicaid cost report therefore quantify that direct taxpayer subsidy required to keep Riverside Rest Home operating year after year. The trend shows escalation, not stabilization. So while losses fluctuate year to year, the overall pattern is unmistakable. Losses exceed 6 million annually in most years. Losses exceed 9 to 10 million in 2022 and 2023. Even after post-COVID adjustments, 2024 still posted a $7.17 million loss. This demonstrates that the problem is structural, not cyclical, and not resolved by time, not resolved by management changes, and not resolved by any sort of incremental adjustments. The cumulative taxpayer impact is substantial and ongoing. A $66.2 million operating loss over 10 years represents a long-term fiscal burden that compounds annually. This figure does not include pension and employment liabilities, insurance cost escalation, capital replacement or new construction, regulatory compliance cost growth, risk exposure associated with operating a high liability healthcare facility. So any proposal to rebuild, replace, or significantly reinvest in a county-owned nursing home must therefore be understood as a commitment to decades of additional taxpayer exposure layered on top of an already demonstrated loss profile. Now I'm going to get into the piece here with the rising pay. Rising pay while the facility bleeds cash. So this is the Medicaid cost report losses, plus the county budgets, plus union wage increases from 2021 to 2026. So the financial record for Strafford County's Riverside Rest Home exposes a contradiction that has become impossible to defend. The nursing home is losing millions of dollars a year under standardized Medicaid accounting, yet wages and benefits keep rising as if the operation were profitable. This is not prudent governance at all. It is a slow motion fiscal trap paid for by taxpayers who are largely unaware it's happening until now. They are gonna all know exactly what has been happening here for the last 10 years. That's gonna be crystal clear.
But I don't mean to interrupt, but anybody who has health insurance knows. It's like I hate to bring it back to schools, but it's really what I know best. If you look at what happened with school care, what it did to the school districts this time, on the small side was Oyster River, which is a $400,000 hit. But each year when you do the guarantee healthcare maximum, it is an adventure. And for many, it was north of 10% this year, which is by my math more than 3 times the rate of inflation. So it is exceptionally challenging under that circumstance to come like a business.
And I would dare say that I respect what Representative Potential has presented, but at the same time, if you compare it with other nursing homes, private ones or other county nursing homes, you'll find that we are not out of line with what others are doing, and we're not corrupting anything. We're paying what the unions are agreeing to. People who work there know what the economy is. They know what they can afford and can't afford, and they're coming to some reasonable agreements with the commissioners. And I believe you can't just look at our county nursing home and say, this isn't working, that's not working, shut the place down. You can't do that. We have to look at what we have now, look at what the future, to the best of our ability, predicts we will need. And you have to compare it with other nursing homes and such. And I don't believe for 1 minute that we're doing anything over there that isn't appropriate.
I'm not saying that. I
Actually,
haven't said that
No,
one time at all.
saying
I'm
that.
not saying that. There's
I
not,
know you're
nothing
not.
about being
I know you're
inappropriate.
not saying
And
that.
I don't-
What I'm saying is we have
We
to,
can't,
we need, I've got the floor. We need to be able to look, if we're comparing anything, we need to compare it with the like facilities and such. And what we have now is meeting some needs of some people. And I still go back to, what do we do with the indigent population? They cannot afford private nursing homes. Private nursing homes don't want them. By law, they're to take in a certain number of residents or patients, whatever you care to call these individuals. But they can't just take over the population that we have at Riverside. We have to take care of these people. We have a legal and moral responsibility. And if you want to shut Riverside down, we're gonna have to have legislation for it,
Just one quick one.
and it won't
Oh, a
work.
voucher program, a voucher program.
Medicaid is-
I just have one thing about the.
Medicaid doesn't work like that.
I wanna do one quick thing with the wages though, because I can, just anecdotally, my daughter is an LNA at Portsmouth Hospital. And the salary of the LNA at Portsmouth Hospital is no different than the salary at Riverside. Actually, Riverside, we brought it up to be comparable. I will tell you, it is a extraordinarily hard job. She's had since high school. Her other gig is working as a cash register or working cash register at Hannaford. There's no question. Most normal human beings would take the same pay at Hannaford's to work the cash register than to be an LNA, because it is a really, really, really hard job. So I think if you're gonna throw out the salaries thing, you have to throw out, are our salaries comparable and the benefit package comparable to the private care? I just caution you on that.
Good point.
Yes,
All right, can I finish? Cause we keep
Sorry.
interrupting, so
All right.
then you know, this is what I mean. This isn't about comparing it to another nursing home or another county or whatever. This is literally the hard reality. These are the facts, these are the numbers. That's it. I mean, I'm not making anything up. There's no agenda here.
Yeah.
This is like, A plus
That's all-
B
that's all
equals C
that-
here.
We're all, we
Okay,
agree.
so,
We agree. No disagreement.
No disagreement with that.
all right, so back to the total Medicaid cost reporting operating loss, which we went over, 2015 and 2024 is that 66,190,714. So that's not a bad year. That's a structural insolvency on public life support. So at the same time, wages were increased again and again. So despite the decade-long loss record, RRH union wages were increased on the following schedule, which I have here. 2021, 2.1% increase, 2022, 4% increase, 2023, $2 an hour increase, 2024, $2 an hour increase, plus $4 an hour increase for 30+ hour employees, $3 an hour increase for less than 30-hour employees, 2025, 4.5% increase, 2026, 4% increase. These aren't just minor adjustments when you apply them to a labor-intensive institution like a nursing home. So every wage increase also inflates overtime costs, payroll taxes, retirement contributions, workers' compensation, and the benefit base that compounds year after year. So the county is not just raising wages, it's locking in larger future liabilities. So the budget confirms that the taxpayer backfill is growing. The county's budget trajectory shows rising Riverside Rest Home spending and explicit recognition of labor-related pressures, even in administrative line items. The 2026 proposed Riverside Rest Home budget totals $39,342,578 million in expenditures. The 2026 proposed budget with major labor-heavy departments, nursing, SBU, dietary, housekeeping, comprises, of course, the bulk of that cost. The same documents show as $684,860 Riverside Rest Home Union settlement, rising insurance costs, of course, and employee health insurance rising material in 2026. And critically, the budget structure may explain how makes it plain how this works financially. When revenues don't cover expenditures, the balance becomes to be raised by taxes, quote. When this, why this isn't, of course, economically, why this is economically indefensible. Loss-making enterprises, in a sense, don't increase payroll unless someone else is forced to pay. So, like we said, in the private sector, a facility that loses 10 million or any of that would not be handing out new increases and step-ups. It would be restructuring or closing or phasing down. Riverside Rest Home can do the opposite for one, can do the opposite for one reason. Taxpayers are the shock absorber. County ownership turns losses into an invisible tax. So Riverside Rest Home's utilization has declined materially since 2019, meaning fewer residents are available to spread fixed labor costs across the whole thing. If you have fewer residents, you keep your payroll growing, cost per resident explodes. When cost per resident explodes, the Medicaid cost report loss grows. When the loss grows, the taxpayer subsidy expands. This isn't a mystery, it's basic economics. This has functionally become a protective jobs and benefits program. I'm going to repeat that. This has functionally become a protected jobs and benefits program. The pattern is now unmistakable. Despite loss after loss after loss, the county continues to ratchet up the compensation and benefit commitments. This is why taxpayers feel squeezed, even when they hear claims of care and need. Economically, what is being preserved is not sustainable, and not a sustainable service model. It's a compensation structure, and the public is not being asked plainly and honestly, do you want to subsidize a structurally loss-producing nursing home indefinitely while approving repeated wage increases and benefit growth? They are just simply billed. The scathing truth. So this is like the financial denial paid for by the public. After 66.9 million in Medicaid cost report losses, the county should be doing what every responsible operator does in a loss crisis. Freeze compensation or growth, or strictly condition it. Shrink footprint to match demand. Implement a rapid orderly drawdown. Stop expanding long-term liabilities, or exit an unsustainable line of business. Instead, the county is paying more while bleeding money and expecting taxpayers to cover the difference without noticing.
Kelly, can I interrupt a minute?
I'm done. This is it. This
Okay.
is how governments go
Because
broke. This is not through one scandal or through normalized or recurring deficits, masked inside budgets, justified as inevitable. So this is not compassionate governance. This is a jobs and benefits preservation system financed by the broader public, crippling taxpayers under their noses. And I'm done. That's it. And that's all I have to say about that.
Okay, I guess I would have appreciated, rather than reading that whole thing aloud to us, that you might have sent such a large.
Yeah,
link
you're
in
gonna have
advance,
all of that.
but,
It'll all be in a big fat report for all of you
Um,
within probably 7 days. So you'll have it all. Then it'll go
But, you know,
to,
some of my initial comments of that, as has been said, this is not a business. And many of these structural problems have been handed down to us by cost shifting at the state level and the federal level, which we didn't create those structural problems. But
then
as
why
far
aren't we
as
fixing them though?
wages,
Then why aren't we fixing them?
if we were to cut wages, we would likely not be able to retain employees, right? But they are comparable elsewhere across the sector, and there's an extreme shortage of healthcare workers. Which, if we will lose workers if we cut their salary.
I didn't say to cut their salary. I didn't say to cut their salary. No, I didn't. No, I didn't. We continue to give year over year
Can you not
increases.
interrupt?
No, because you're putting words into my mouth. I didn't say that at all. We're giving a 4% increase. Our commissioners, why aren't they going back to the union to say, all of these taxpayers, they're not getting a 4% increase on their salaries? Why aren't we doing that? Why aren't we saying, hey, sorry, this year, no go. We're not gonna do that.
Can you let other people speak?
Um,
If salaries don't keep up with the cost of living, and we do have inflation, that is essentially a real wage cut for workers. Rep. Howland.
So, I mean, I have been fortunate or unfortunate to have worked across multiple sectors of what you would call the job protecting kind, which is which is, I think, a mischaracterization. I'll call it public service. So I've done it across the school system, I've done it municipally, and now I've done it at the county. And they all have the same thing in common, that they're filling a need for the community. The question I'm gonna distill, and all of them operate at a loss uniformly because they meet a need. And we have not been able to privatize them at all. So I'll just boil my question down to this. Can you do this more efficiently than $7.1 million? And if so, how? That is the crux of the question. If and we say we're going to reduce, fine. Okay, we want to reduce our footprint. Where are said people going, particularly since they're carrying that structural problem with them? The structural problem being the funding that goes. So if we want to have Riverside, close Riverside and put 150 people out, where are they going? And where structurally will they be absorbed? Because all of the same problems that you said, nursing care, like education, is a labor-intensive system. A labor-intensive system, it's not just the salaries, it's those benefits that follow them that kill you. And made much worse, by the way, since we as legislators have not funded the pension of much of our municipal employees and passed it on to taxpayers. So, a long-winded way of saying, for us as a committee, we have identified that we are operating at $7.1 million loss. And I don't think anybody around the table disputes that. In fact, anybody who's gone through the budget subcommittee and pulled up the thing has seen it. They have seen it across all of our sectors. The question is, how do you do this at less than 7.1 million? Or if you cannot do it, is there a mechanism to control your costs at the rate of inflation? Which we have seen, as I've just said, the county isn't operating at that, the municipality is not operating at that, and the school is not operating at that currently because of the very systemic problems that you're talking about. So how do we as a county come up with a plan, or what are our options? Is it close the nursing home and send it to a private one? Is it expanding the choices for independence? What is the most economically viable and sustainable method? I think from my perspective, that is where I would really like to hear, because hearing that we're operating at a loss at the county, hearing that we're operating at a loss at the school system, hearing that we're operating at a loss at the municipality is depressing. What are our alternatives? And I think none of us, all of us acknowledge the structural problem. And I think that was actually one of the very first things that Representative DeRoy said, which is, what are our options? And can we do this at less than $7.1 million in loss?
Okay.
Sorry to be long-winded.
It's all right. Can I address the committee?
Yeah.
Okay. First of all, everything that Kelly said there is it's not a surprise. It's not a hidden cost. If you look at every year and annually in the county budget, you'll see the operating cost for Riverside Rest Home and its revenue. And there's a big difference there, and it has been for a very, very long time. I just want to take a second, if I may, and back up a little bit as to reasons why this exists. When I was first county commissioner, Riverside Rest Home broke even or made a profit every year. And that's the facts. You go back 40 years ago, you will see that in our cost reports back then. Not just the last 10 years. The simple fact is that the state's responsibility to fund Medicaid has not been met. It's as simple as that. Now, the philosophy of the county being in the nursing home business started in the late 1960s. The philosophy is that the county would take all the poor and all the really hard, heavy care patients that there were to allow the private nursing homes to make a profit. okay? And that was the model. And that's been the model for 60 years, okay? That we would take all the indigent, we would take all the heavy care patients, the ones that were behavioral in nature, all those things, so that the private nursing homes can make a profit. Now, right now, about 65, 63, 65% of the folks that are in nursing homes are on Medicaid. Now, how the private sector is able to offset that cost is that they take private pay patients in and they spend them down. They take whatever assets they have and spend them down at a particular rate, okay? Now, we, the county, do not take private pay patients, okay? We don't take them. Now, we don't take them from a philosophical perspective. If you want to increase the revenue side of its operation, you would have to take private pay patients. Okay, you take people with money and bring them in and have them privately paid. Now, we have a few of those that they're called spend downs. We have a few. But the structural philosophy that's missing here is the fact that the state doesn't meet its obligation. It's just as simple as that. If we would have fully funded Medicaid, and the erosion started about 18 years ago, 15, 18 years ago, when Commissioner Stevens was put in, and he came up with this budget neutrality back. He invented it. And he said to the legislature, we can drive the cost back to the counties secretly or hiddenly, however you want to put it. We can drive the cost back to the counties, okay, and not have to fully fund Medicaid. And that started about 16, 18 years ago, okay? And there's been this slow erosion over time of the state not picking up 25% of its share, okay? Initially, when this was set up, the state through the general fund paid 25% of the share, and the counties paid 25%. And then it actually really started, if you really want to get into it, with Sununu the father. Because I was here. John Sununu, the state was in budget deficit. He called the counties in and said to us, would you please take on a little more expense of Medicaid? Okay, take on some more expense of the Medicaid. Let's shift the 25-25 split to 20-30. Have the counties take on 5% more. It started with John Sununu the father. Okay. And we said, okay, we'll do that. We'll do that. Then Sununu bragged about how he had a $40 million surplus in the state budget.
I remember that.
You remember that?
I just got here in 1983.
Okay, and so the point being is
Yeah,
that-
most people don't, I don't wanna interrupt you,
Yeah.
most people don't know that history, I actually do know that
Right.
history. And unfortunately,
You have part of it actually in your report, just.
Yeah.
Correct.
Showing this.
Correct. exactly, and I want you to continue, so keep on that.
Okay, so the answer now is, because the state is unwilling to fund Medicaid at the level that it should be funded at. Okay. Then the only other structural answer to fix the structural problem that we're faced with here, because it is structural, I don't disagree with any of that. Okay. Is that we're gonna have to think out of the box and come up with some other form of private-public partnership.
Yeah.
Okay, that allows, I hate to say it, but you're gonna transfer the cost to the private sector in some form or manner. Okay, to absorb the cost of the Medicaid client that's continually being underfunded for the last 18 years anyway, okay? That's the only way you're gonna do this. It's the only way out.
I mean, I'm saying, so it comes back to what I said.
And in my
Can we
report,
do
what
this
you
for less
said,
than 7.1
yeah, in my
million?
report, it does, like, when you ask that question, in my report, it has multiple chunks of these answering solutions. And I'm not
Right.
saying that they're, you know,
You either gotta
I'm not
fund
saying that
Medicaid-
they're any silver bullet,
No.
but it gives. I mean, we're not gonna go into all of that now, but there are very big chunks of that, and through outside help, because this is not my expertise. You know, a person that you're talking to too, that's an expert in all of this, has been very helpful. But, and from another state, because just so you know, our county model is really somewhat, a dinosaur. And it's an anomaly at this point, because that is the reason why other states don't have this model. And I think that, you know, to your credit, what the commissioner said is very important. This is why facts matter. Like, I really hate when we talk about, oh my gosh, they get Democrats, they did all of this or whatever. Well, actually, the Republicans did this too. But we're like, we like to champion too and say, oh my God, look at how much money we have. But what did you do to create that surplus? Somebody's paying somewhere. And I know that. And I watch all of this stuff happen just in my second term here in the House, and it drives me berserk. Like, facts matter, honesty matters. So I really believe that we have to stop giving credence to people that talk out of both sides of their mouth, and we have to look at the facts in real solutions here. We are in a crisis. I am telling you right now, the people that I have spoken to, on both sides of the aisle, these are the taxpayers. When you tell them 1 year, one resident, over $230,000, they lose their ever-loving mind. Okay? So does it mean that, what does it mean? 100, let's say that we decide to help a certain, we set up a, I don't even know, a trust, something, whatever, and we help a certain portion of the indigent population in Strafford County. Give me a number, whatever that number is. Are we gonna help 100 people for, we'll help 100 people in a year. That'll cost us what? $10 million or something like that. $100,000 for 100 people in 1 year, and we do that. We put that aside, okay? That's 10 million. That's what we give. That's what we're giving. That, whatever it may be, whatever number we're looking at, it's still a hell of a lot less than 39 million. And it's and all of that. And also the other piece of this too, which is really important, is the shortage. I know that we have fantastic staff at Riverside Rest Home. I see Bauer there, and he's like looking down or whatever. This isn't like pointing fingers or whatever. We have some really amazing staff that have worked very hard within this system, but the system is broken and it's not sustainable. So how can we do this? Our staff could very much be absorbed by other nursing homes. So that's not gonna be, their viability and their future and their jobs. That's not a problem here, because there's so much need. But I really think that it's extremely important that we come there, and we have to stop this. There's no us against them anymore. There really needs to be some real unbelievable freaking solutions here. And my report's gonna give a whole bunch of them, but right now, we've got a budget that's gonna come up. And are we just gonna, this is where, of course, the Republicans are gonna vote no, but what can we do at this point? There's gotta be some sort of solution here. We can't just rubber stamp another one.
You really gotta let other people participate.
Okay, but I'm just saying, we can't just rubber stamp another, what are we gonna do? Like, my report isn't gonna save the day, and neither is yours, but we're gonna just rubber stamp another budget? It's crazy to me when everything is falling apart.
I think generally speaking here, and this is just me, given the nature of the fact that the federal government right now is looking at changing the Medicaid system, okay? I think that this entire discussion should be postponed, frankly. Because there's nothing we can do structurally right now unless you go to the legislature, and you're all in the legislature, and fully fund Medicaid.
That would be awesome.
Okay, fully fund Medicaid.
That would solve a lot of problems.
That would solve, that would only help the private sector, but it would help all counties, not just Strafford County. It would help all counties. Come up with a way of fully funding Medicaid. Okay, and that would be the first step. Now, if we're not gonna do that, you still have the federal government here talking about, depending on the nature of what happens at the next election, what's gonna happen to Medicaid. Trump has indicated he wants to shift all Medicaid costs back to the states. Okay, now, I'm just gonna give you a little taste here of what we're talking about here, okay? If that occurs, this state is in serious trouble. You're gonna have to come up with, you get structural problems now. You wait till all the full cost of Medicaid comes back to the states. Now, he's talking about doing it over a 5-year period or a 3-year period, and Congress is sitting there playing games. The bottom line here is that we just need to take a deep breath here, okay? Because we are in there is so many changes being contemplated and being made that whatever decision we make will probably end up being the wrong decision, okay? Because we don't know what's going to happen. There's no stability in the system. And that's what Ray and I were talking about before. And Ray says, like, we can't guarantee you the financial flow of money, how it used to be when we first proposed this 4 years ago. That's all changed, okay? So I just think we take Kelly's report, we take your report, and we take a deep breath, and we have to sit back and wait to see what the federal government's gonna do. Or you folks go to Concord in this session and fully fund Medicaid and come up with a tax or some ability to adjust the state budget to do that. That, first of all, let me tell you, let me say one other thing. These deficits, we're leaving 50 cents on a dollar with the federal government as a result of these deficits. Now, this is something I've discussed with the state for 30 years. Okay, well, about 25 years, actually. The deficit should be matched by the federal government because these are Medicaid clients. It's a 50-50 program, right? Well, if we're taking all these Medicaid clients and we're spending all of this money, and that's not only in Strafford, it's every other county is the same way, okay? We're leaving 50 cents on every dollar that's spent with the federal government because in the way we structure our rate system. Now, I know that's a little complicated, but it's true. It's been something that's been discussed by the State and County Finance Commission for almost 2 decades, okay? Now, New Hampshire in our state Medicaid plan decided a few years ago, okay, you're probably right. It's 25 years, yeah, we're probably right. No, we're not probably right. We are right. We're leaving that 50 cents on a dollar with the feds, okay? So there are things that you can do to the system structurally that would ease the pain on the property tax, okay? But you're gonna have to do it at the state level. We can't do it. Okay, we don't have the ability. It's not like we haven't told them about this. The County Association of Counties have said this repeatedly to the state, okay? And it just depends on, and it's through Democrat and Republican administrations, it didn't matter, okay? Because nobody wanted to raise the tax. Nobody wanted to come up with the money, pay for it, okay? And this way here, they can secretly, or not secretly, but it's a kind of a sleight of hand, just push the cost back down to the county for Medicaid, which is a federal health insurance program.
Yeah.
It's a state and federal health insurance program. The reason why other states don't have this problem is because they have other forms of taxation that we don't have.
Yeah.
I'm gonna leave it right there.
Based upon what you said though about the schools, what he just said in regards with Medicaid is the same exact scenario in a sense with what we have with special ed.
Yeah.
Because
Yeah, it's true.
the Fed,
Absolutely.
I'm talking about I don't know about other states, but with New Hampshire, we're basically, it's like, I think it's about the same, like literally, we're losing out. They were supposed to pay for about 50% that we are absorbing that cost. So special ed is the killer in public schools. So it's that same.
That's one
same-
of the-
Okay.
I just said. Rep Schmidt.
Okay, so I've been at this game for a while too. And this discussion is very, very important because the bottom line here is this ship is taking on water. Just like the Titanic. The designer of the Titanic was on board. And after they hit that iceberg, they went to him and he said, remember, they said the Titanic was unsinkable. Even God couldn't sink that ship. That's what they said, and so forth. And he was on board. He said, this ship is going to sink. Well, we all know it did sink, but we're facing a sinking ship too. And the bottom line is, and this is, I think, in many respects, one of the major driving forces for you, Kelly. And I respect all the work you've been doing. And the bottom line is, it's not only wrong, but it's very unfair because where is the money coming from? It's coming from the property taxpayers, okay? And those people, I mean, I hate it. My property taxes hit $10,000 last year for the first time. Okay. I am operating on a very thin margin. I'm not poor, but my available cash is very narrow. And there are a lot of people out there who are a lot worse off than I am. They are underwater right now. They're borrowing money or they're splitting their their medicine costs and their food costs and so forth. And we can't go on because the ship is sinking. And the other side of the coin is you've laid the money out and everybody says it's the same way everywhere in New Hampshire, right? It's not just Strafford County, it's everywhere. And I know you voted against the budget,
I did.
right? And all of us voted against the budget too, because there was a lot of sleight of hand and,
He voted against the budget and he voted against the budget as well.
well, I looked at the list, I can't remember all the names, but I remember I looked and I saw. So, and we are a portion of the legislature. And to the degree that we confront the reality that we cannot just shove this down the taxpayers' throat as if they can go on forever.
That's right.
Because they can't, and it's not fair either. You can take money from a rich man who doesn't want to give it, but at least he's got it. These people don't got it.
Oh.
So with this discussion we're having is really important. It's really important because we've got to confront the reality, and your numbers all show what the reality
They have an
is.
irrevocable trust,
What?
unless they have an irrevocable trust.
Right. Then they
Yeah.
do it.
I know, I can't get the money from Tom. I'm trying. I'm trying. I'm trying. I'm trying.
So let's let's acknowledge the reality and Commissioner said Kelly's numbers are real. There's no, it's not fudged or misrepresented.
This
It's
never got
real.
brought up till this year.
What?
I never heard all these budget talks every year. Nobody ever brought this up. About this deficit.
Well, a lot of this, I'm not a mathematical person,
Commissioner
so
bring it up.
much of this stuff is, but the point comes when the ship is not only sinking, but it's just about to really sink. It's not just going down in the water, it's going down now.
I'm glad we don't
And I
have a
think-
big mortgage, a $300 million mortgage on a new nursing home would be even worse, right?
Well, it wasn't.
There are lots of things, but let's not blame one another now to no purpose. Let's talk about the reality, let's confront the reality and saying, what can we do right now? I'd like to get this cross off the property tax, the poor property taxpayers, because I'm not one. I'm not poor, okay? I may have a lousy cash flow situation, but I'm not poor. But the people who are really poor, but they have to come up with it somehow.
Yeah,
Does it
can
say
I-
it's 6:30 right now?
I know.
Even the stop clock is right, but this was not. Okay, so let's confront this reality and see what we can do to try to save our property taxes. Thank you for the opportunity.
I think we can't ignore some of the larger structural problems that are creating this whole thing. The fact that we pretty much force people to go on Medicaid to get long-term care is a structural problem that we spend our entire working lives paying into private health insurance, and not one penny of that money goes into taking care of us when we're old. Really, why should we even have a separate program, Medicaid from Medicare? Right? Why isn't Medicare paying full price for long-term nursing home care that we need, right? Because Medicaid is extremely expensive.
Medicaid was the bastard child of Medicaid.
Yeah,
That's correct.
and it was a mistake not to pool those things together, but I'm not.
That was the feds,
George,
that was
huh?
the feds, and when the feds established it.
Yeah.
When they established Medicaid, which was the bastard child of Medicare, what they did was the federal government didn't wanna pay for it all. So then that's where they created the 50-50. Well, they created different states based on their cap, on their
Right,
wealth.
it's not uniform.
It's not uniform, Medicaid's not uniform, in Louisiana, the feds pay 80% of the cost. and the state only pays 20%.
Yeah.
Can you
But the
finish
other-
I'd like you to finish what you were saying.
Yeah, I mean, and the other problem with this, how it really hurts poor people, is that you even have middle-class families anticipating enormous long-term care costs.
Yeah. That's true.
And, wealthy people, the very wealthy, they don't care. They can pay cash for everything, right? They don't even need insurance. They're self-insured. But even middle-class families will have the wherewithal to hire a lawyer to put their assets in a trust and shield it. So if they run out of money, they will be eligible for Medicaid.
So
I mean,
the
that whole-
taxpayers have to pay somebody that's saving their money for their heirs.
Yes, but
I did that.
is it really so wrong?
It is, in my opinion.
But isn't that the way we all want to see things, that we want to pass something on to our children? Most of us would like to do that, but we force the poorest among us to give up everything just to get the care they need, not leaving anything for their children, and I think that's horrible. And so that's, why we even have to put people on Medicaid at the end of their life is a shame. We're the richest country in the world, and this is what we do. We don't take care of our people when we're old. So Medicare for all, for one, let's do away with Medicaid altogether. And, give people the option of having a real health insurance program that would cover them their whole lives and not wasting all this money for private health insurance, which contributes nothing to this, helping us solve this huge problem that we have right now. So
But the
that, and the
Affordable
other
Care Act.
thing, huh?
Yeah,
It's
let's,
got the Affordable Care Act,
That-
it's all taken care of.
oh my.
We all know that did not solve the problem. We all know that. It was like, it fixed a couple little things that you can't be denied for having a pre-existing
It
condition.
pushed it off just a little bit for a few more minutes,
but-
Yeah, but
The
yeah,
oth-
she's right. The Affordable Care Act had like three main points that were good, that protections, but the whole program was just another robbing Peter to pay Paul shell game.
And a
The-
lot of
Sorry.
public funds going directly to private insurance companies through the subsidies. Also a total waste of taxpayer money. But the other big problems with, the whole Center for Medicaid Services, it's a really, as Ray Bauer has testified, the amount of paperwork that has to be done every single day whenever you take these funds is overwhelming, and it contributes a lot to the cost of what it, that so much documentation. It's incredible. And all well intentioned, because no one wants to see fraud, no one wants to see
There is
use, no one wants to see drugs being mishandled in a facility. But all of that, we need to reduce the waste and the tremendous amount of paperwork that has to be done.
So I try to leave like depressing things with some optimism, hopefully. So I'm gonna come back to my original question, because I think along with, the funding mechanism is answering part of this question. The question is, how do you make up the $7.1 million delta? That's the simplified question and I think out of all of these reports, we've done a great job of showing historically where we are, what other counties are doing, and what the cost is of doing this. The question is, how do we get out of this problem? And I think I just wrote down funding. You just said it, legislative. Okay, but besides that, and I always get a kick out of people saying, well, the legislature just has to do that. I was like, oh, really?
Right.
Did you watch yesterday? So maybe you should, because you'll get a real idea of how it works in the legislature. Because I can say it is a really interesting place to work, especially since you work for $100 doing it. So,
Right.
so that being said, yes, I think this report that we have together is really good, but in the solutions part, we can put a funding section. Yes, fund the state. All right. Besides the funding structure, what else can we do? You've already alluded into public-private partnerships. Obviously, it could be structurally that a private place could potentially take more of our people, but but how is that economically viable? In other words, if the revenue stream that individual patient has that I'm pushing off to you is exceeded by your operating cost, it is not, then they need some other mechanism
You would need,
to make up the delta in money. So how do we do that? Could you do a mixed structure that the county is taking the Medicaid part? And I don't know what that looks like, but that's what we need to look at. In terms of waiting, I do not want to wait. I know there is a great deal of uncertainty, but like anything, I mean, I tend to work in zoning. Zoning takes years to get done. I mean, at a critical pace, we're moving at maybe 5 years. So I think if we can lay some structural foundation down now, so that whatever does come, we at least can adapt to it. So I think it's our responsibility to we've laid the financial picture down, but we need to lay some options down that I think our delegation can look at us and say, you know what? Go look at these, go study these.
So one
Like you
piece
said.
of my report talks about, it's not a public-private partnership, but it is, and I could be butchering the terminology of this, but it's pretty much, it's a relationship that's all done, and it's all done legally, that where, for example, they have a bed that is truly still at Riverside Rest Home. There's that piece of that. They can absorb some of those quote unquote beds that are there. So there is that piece it'll be talked about in there. As well as, if they are going to take some of, let's say if it was a phase down, let's say if we did anything like that to where we then put some things into, it can't be a voucher. I've already went down that whole path. I understand all of that with yes, with Medicaid, Medicare, I get it. There's tons and tons of laws, federal laws, restrictions in regards with that. But I have a section that talks about this, and all of those things are extremely structured in the beginning, where so you don't have a private company or a private facility say, oh, we're gonna take your best and we're gonna leave, that's that piece. It's exactly, there's no cherry picking there. So I have those types of things
You're
covered.
gonna transfer, what has to happen is, let's just call a spade a shovel here for a minute. What you're gonna do is you're gonna transfer your Medicaid costs or your deficits to the private sector. And that's what you're doing. So, and that's okay, because that's gonna be the new model, okay? You're gonna transfer that cost to the private sector, okay? Now, the question is, how do you do that? How do you transfer the cost to the private sector and still maintain the Medicaid population, all right? And there's probably ways to do that, okay? You gotta think out of the box. You gotta really think out of the box.
It's easy.
But as an example, you'd have to have at least a 3-to-1 mix, minimum. 3 private pay patients to 1. Now, let me give you a quick example I'm talking about. If you took Riverside right now, and you took in 75 private pay patients, first of all, if they would go to that facility, because nobody wants to pay to go, nobody wants to pay to go into an old building.
New one would.
In a new one, right,
The new wing.
right, the new wing, oh, actually, just forget that building at all. Just build a brand new place with the private sector where you have a 3-to-1 mix. Okay? 3 people paying privately at, say, $350 or $400 a day. All right, and they have the Medicaid client at the $60 to $145, whatever.
Yeah, what is that right now?
What is it?
Our Medicaid rate.
Yeah, what is it?
About $256
A day.
a day.
A day, okay, so you go at 400.
Except the behavior unit, which is.
Yeah, don't talk about behaviors. I'm talking about the straight Medicaid, I'm not talking about the behaviors.
Okay.
Yeah.
So you have the mix is almost 3-to-1. In order to get the private sector to at least continue to make a profit and have that Medicaid plan, okay?
Yeah.
So you got 4 beds. So think about it. All right, if you've got 200 licensed beds at Riverside, and you were gonna just eliminate Riverside and have the private sector absorb it all, right? They need at least three payers, three people paying privately for one person that's getting reimbursed by the county or the state for the Medicaid claim. So those are the kinds of ideas that when you think out of the box, we need to be looking at, okay? Or you cut that, you can cut it in half and fund it at half the deficit instead of being at 7 million, it might be at 3.5 million. You're still gonna fund it.
Yeah.
It's because it's all it is numbers.
No, I'm just,
That
I
one
know
piece is-
predicament, no.
Correct.
No,
I have
it's
no argument.
it's just math, okay?
Totally.
Yeah, if you cut it in half, you're basically, you're doing
Right.
that just to
Right.
quote unquote save money, but you still, that liability is still all right
So
there.
here's what, you're just transferring the 7.1
You're just transferring the cost of the
That's
private
correct.
sector.
And
Can I
I,
just say one thing that I think got missed? Although you said it, I just don't think the logical piece to me would be, if we could transfer some of our Medicaid people to nonprofit entities.
Right.
What you said to me, or what you said earlier, was that you had Catholic Charities come in.
Yeah,
And
Right.
now they're a logical entity to transfer to.
they're in rough
And,
shape.
and you said that they came in and testified in front of your committee,
Yeah,
just in the last couple of days, and said that they're in deficit.
they are in bad shape.
yeah,
You know,
Right.
so I just wanted to point out that an opportunity to take our 170 Medicaid people and move them, I mean, the logical point to me would have been Catholic Charities. I mean,
Yeah.
that made sense, you know,
What
that,
committee are you? Are you Ways and Means?
Housing,
Housing. Oh.
you know, that
Yes,
made
that's all
sense,
of it.
that made sense to me.
yeah,
And then it surprised me, frankly, to an extent, when you said that Catholic Charities is operating at a deficit. Now, I'm not shocked because everybody lost money, you know, some $20, $30 a day. Fortunately, we didn't lose that much, but we still lost money.
yeah,
And I think that that's gotta be factored in also, and remembering that they got, and I only know about St. Anne's, wonderful nursing home, by the way.
It is.
I've been there,
It's
it's
a
great.
wonderful nursing home.
St. Anne's is a wonderful
Yes,
nursing
it
home,
is.
and they take a mixture
Yeah.
of private pay.
Yeah.
They take a mixture of, skilled care, and they take a mixture of Medicaid, and they're still losing money.
yeah.
yeah.
Hmm.
So, I mean, you know, that to me clearly shows, you know, the
structural
the added structural problem of the
Yeah.
lack of funding of Medicaid.
The group
Yeah.
that was not having trouble was Riverwoods.
Oh, of course, not.
Of course not. Great, they're doing an expansion.
Bet
But you
their
said
rates are
Catholic-
going
they
up
came
too.
in and testified, so I don't know what they said, but I mean, I think we all know here why like a Catholic Charities is in the situation that they are in, which a lot of them are. So they relied on getting, especially during COVID stuff, right? They relied on big numbers that were coming in, big grants that were coming in. And then they took that money that they should have realized that's gonna go away. And they built budgets, organizations, staff off of that. You can't do that. That money, which that
Long
was
time.
probably the biggest mistake that we ever did with the CARES Act.
Huh.
Where was that gonna then be? How are you gonna get that back again? And so that is really where, that's why it was like getting hit by a freight train, pretty much. So that's a lot of the reason why a lot of these organizations are in that mess.
So Rep. Kaczynski, but we're gonna have to wrap up because we have
Yeah,
another.
before we wrap up, I'd like to ask a few questions of what I heard today, and I'll try to be brief as I can. So I heard Strafford County made a profit on nursing homes. So,
No, our nursing home broke even or made a slight profit when I was first coming.
so if I'm to understand, that profit was a result of more money for Medicaid being
Correct.
allotted.
Correct.
So in other words, it was taxpayer money
That's right.
is what made the profit here in
Right.
Strafford County.
But not property taxpayer.
Not problem.
I don't care where it came
Yeah,
from.
but it makes a big difference.
If
Big
you're one of the
difference.
top 5%, you're paying a very high income tax. then you're getting affected by this. I mean, you might have a concern where your money
Well, we're
goes.
all, we're all,
Okay.
we're all
I'll
involved,
go on
that's
that.
for
The
sure.
9 to 10% healthcare cost, Representative Holland. Do you work in the private sector with this type of thing?
Well, actually, my wife works in the private sector. She's a OBGYN and had a private practice for 25 years. So yeah, I'm familiar with the private
All right,
sector.
so what I'd like to say is this, when you say, it's as if that 9% or 10% increase is always gonna go on. We're never gonna adjust the level of that quality plan they have.
Oh,
We're
that's
always
not
gonna
true. I
give them
didn't
the
say
same
that.
level, no matter what it
We
costs.
always do. What do you think when you
Well,
go?
why,
into a
why
union
is that? You don't do that in the private sector.
You do that in this
People
sector, in
compromise.
this sector, you do it, actually. In a union negotiation, the first thing you pull, actually, as me speaking, I've been on both sides, actually. I've been in a union, I've negotiated against unions. But the first thing you go into is trying to control your healthcare costs.
That's
The
true.
wages are not the first thing that you're going after. And you trust me. We chisel away at people's health insurance is a strategy we always use. First of all, trying to push the boundary between 80-20. Second of all, trying to move you to plans that lower our liability, particularly younger workers who are at lower risk. So we do that.
Okay, another question. We're talking about 170 residents here. Now, I've got this chart here. I went back on a few years and it shows that approximately half the people aren't from Strafford County. We have out of state and we have out of county. So we're supposed to assume that we're responsible for this. These costs you're talking about, this 230,000 per person. We're paying for somebody from Maine or from Tennessee. I mean, really, there's a lot to talk about with this whole project here. Because-
Well, towns have to live in the county, I'm sorry.
Yeah.
Right, but I know that we take
There's-
some
we
other
take-
county.
Well, if your family lives here, yes, we'll take you to join your family so that they can assist with your care.
Yes.
And if there is an opportunity for a discharge, okay, which we do discharge people home. They're never gonna be, they need to have a local home to be discharged to. So there is a lot of times when I'll get a call, or my admissions department will get a call saying, mom lives in Maine, but we live in Dover, or we live in Durham, or we live in Madbury. Will you take my person? And of course we will, because these are Strafford County taxpayers that are paying to bring this person here. So that happens a lot, but it happens just as much
The person
in
himself should be
in other counties.
So it's reciprocal.
It's reciprocal. Other counties
Right.
will,
Very generous.
are in that same situation. So I don't think we're in any
Both
way
ways.
different.
Very generous.
Well, the feds encourage you to do that.
Yeah, because of this
It's
is
a
one.
federal health insurance program. Remember that. It's
I have to-
across 50 states.
I just want to interject because in my research, that was one of the things that really, that bothered me a lot, okay? But then, based upon what the commissioner was saying, I don't know, several meetings ago, I dug into that specifically. And so I didn't realize, think of it like a statewide thing, like we're all sharing in this big thing.
Yeah.
And to be honest, I don't know where the checks and balances are. I understand if you live here in Rochester and my mom is in Florida and she's coming back up here and we're gonna take care of her. But I'm telling you, that is how it works. It's like a family unit. I know.
Called the government ding-a-ling.
I know it is. It is a ding-a-ling.
That explains
that.
the feds are paying.
I think-
half the
Are we gonna-
That's correct.
But hang on for a minute. The settlement law between states. If you were on Maine's Medicaid, and you came to New Hampshire, Maine continues to pay for you.
That's
okay?
right.
That's how the system works. We took a Strafford County resident, and we shipped him to Ohio. He was with us in the nursing home. And this was before they allowed medical use of marijuana in our state, and he wanted to use medical marijuana. But they were allowing it in Ohio. He was a Strafford County resident, so we transferred him to Ohio so he could have his medical use. We have, this stuff goes on in the system all the time because the feds encourage that. They want that. If you have a family member there that's gonna help take care of you,
Yeah.
then they put it.
So we're gonna have to wrap up for today. Do we want to schedule another meeting and put together
I just wanted to get the,
any ideas?
I mean, I was pushing really, I know I'm pushy, but I was pushing.
No, I want I'm gonna,
I was
I'm gonna
pushing
deliver my report.
for the fourth,
I'll do
but
that.
I think it's, first of all, just by this discussion, we need, and I hate to schedule a delegation meeting where we all have to come, but this should be the focus of one meeting.
One delegation meeting.
That just this on the agenda.
Yes.
Therefore, I mean, I think we mentioned what I really wanted to get to today, which is, kind of we're gonna dump on the delegation, look, this is terrible. But what are some solutions? If we could meet one more time to tie this all up when we're not in the right now, all of us legislators are so busy, it's not even humanly possible to think how, I mean, I'm having brain overload trying to like do this.
So what are you thinking? You already talked about March, right? To do
I
this?
think I think April we should bring this to
Oh.
the delegation, because we'll have slowed down as legislators so that we can actually think, which would be refreshing. We'll have this report put together. If we could do one more of these meetings at the end of March, just to finish this report, so that we can bring it to the delegation, we can make this discussion we just had. The delegation will hear the starting point. We have a $7.1 million deficit. What do we do? It'll allow the delegation to process this and to authorize them to let us go look at the
Here
solutions.
come the gun.
Does that sound reasonable?
Yeah, I think that's fine. And I would assume, I'm gonna have I want my stuff out, so I guess maybe what I'll do, cause I'm not gonna share it. I'll share it with our group, my like final kind of, maybe I'll keep it in a draft form or whatever. You guys could comment or whatever, cause I know you're doing work as well. And then, so we go over that, or like we go over maybe kind of like so the next meeting that we have as a group, we go over kind of an agenda. I really want that full delegation meeting. If you're saying April, I was thinking March, because I remember we talked on the
I
phone
just
about
want it to
March.
be, I want the time to be there for the discussion.
I agree.
I don't want to shove it in like, oh, by the way, you're gonna approve a budget and then let's
Can
talk
we
about
do
it.
it after?
So when is crossover?
Right out straight until crossover, which I don't, does anyone remember a crossover?
I know, I don't remember the
When is
date, but
crossover,
Yeah.
Glenn, do you know?
do you know when crossover date is?
No.
Cause it.
But it should be in the calendar.
I know.
Could we, is it possible, and I don't wanna violate 91A, that we send out a thing, well, let us work on when crossover is in April, yeah, that everybody can catch their breath, and we finalize this. And we get a delegation meeting set up, so we can work, we'll send a thing out amongst the committee.
Yeah.
What we think is a reasonable time, and again, it'll give us a little bit of breathing room. I don't wanna shortchange the conversation by trying to squeeze it into another meeting.
And I do want us to be able to talk and organize how we're going to present to the entire delegation. I want that too. Like, I don't wanna be, an angry elf out there.
Anybody who's got a magic phone, get on JetBoard, get up a calendar, and that'll tell you what day crossover is.
Well,
Yeah, but
we're
it's not-
down in the basement, you can't get online now.
Yeah, I don't have a signal either.
No,
Yeah.
it's simple.
Okay.
Dan.
Alright, well, so we'll.
the calendar up there.
Or second.
Second.
Do we have anybody on? Have we lost all our Zoom people?
Oh, they've been gone for,
They've
gone for 15 minutes.
Oh, those, I can't believe it. Who-
Somebody's gotta call up Susan.
So we
This
can-
actually was a good meeting,
we can-
though. This was a good
You
meeting.
can start without
It was.
objection.
It's a hard meeting.
Without
Without
objection.
Without a-
Thank you, everyone.